Okay, there we go. Well, welcome everybody to our final VT Reach session, which stands for Virtual Teleconference, Reach, Explore, and Aspire to Careers in Healthcare. And tonight, Gillian and I, as co-founders, are going to be speaking. If you want to quickly chime in, Jill.
Yes, we have really loved doing this program and wanted to share our journey from being pre-meds, taking the MCAT, and going through the application. And before we start, I know Dr. Mariquin wanted to say a word or two.
Yes. Good evening to our VT Reach audience. I just want to share with everyone on a public platform how very honored and inspired I have been by Lillian.s.bennett and Gillian Bremer. They approached me 2 years ago with this amazing creative idea, and I said yes. And I didn't even hop in the passenger seat. I'm in the back seat. And these very strong-willed, creative, inspiring women who had dreams of their own to aspire to careers in healthcare. Not only did they continue on their own journey on this path, but they brought so many other people along with them. So I just find them very gracious, and I'm very grateful to have been on this journey with them. And I'm excited to see where their journeys, their professional journeys continue. And I hope that our paths continue to cross. So I'm grateful, and thank you to both of you.
Thank you so much. We're very lucky to have been supported by Dr. Mariquin and Kara Calvelli, the pre-health advisor at UVM, throughout the past 2 years. And, we truly couldn't have done it without the two of them. So definitely want to say thank you to them as well. Two other incredible women that we were lucky to be connected with. But I'll get started. I'm Lillian Bennett, again, one of the co-founders with Gillian. And in terms of my inspiration into medicine, it probably, I always remember enjoying science when I was younger and in schools, kind of starting way back when. But I feel like I remember that first moment that I thought potentially medicine or healthcare or a doctor was in my sophomore year of high school in biology class. Just really, learning about the human body and how it worked, I found really interesting. And we had an anatomy unit that I just found so fascinating, and I felt like I wanted to know more about anatomy and physiology in general. So I feel like that's kind of where it stemmed. And from that point, I kind of began to pursue potentially pre-med as a track when I was thinking about applying to schools. And then I entered, I went to high school at Lincoln Sudbury Regional High School. I graduated in 2017. And it's located in a suburb of Boston. And then I entered in, and I went to University of Vermont, where Gillian and I met. And I actually initially started as a biology major, kind of thinking, you hear if you want to be pre-med, that's kind of a good major to go into. Just it checks off a lot of prerequisites for medical school in general. However, upon kind of delving into the major at UVM of biology a little bit more and comparing it to neuroscience, in which that's how I met Jill, the neuroscience major kind of focused more on the human side of things, while the biology major had some ecology and plant bio that I was a little bit less interested in. So I switched my major to neuroscience and absolutely loved it. I loved the major entirely, and then was also a chemistry minor. So that was my schooling, and that brings me to kind of where I am now within my growth years or gap years. I graduated from UVM in May of 2021, and then we took a couple weeks off and jumped right into studying for the MCAT, studying about full time for the whole summer with an MCAT date in early September. Starting out with studying about 5 days a week and gradually working up to studying a full 7, basically full time. And after completing the MCAT, I actually lived with Gillian in upstate New York with her. And then I moved back to my hometown, a suburb of Boston, where I started as a patient care technician on a med-surg floor at my local hospital. It was our COVID unit as well. So I assisted mostly nurses with nursing tasks. And that included, taking vital signs on patients, taking blood sugars, performing EKGs, helping with ADLs or activities of daily life with patients. And I started, this was my kind of real foot in the door of clinical experience. And while I started there, I was also working on my medical school application, as well as the HPP, or Health Professions Portfolio, which was offered through UVM and the pre-health advisors. And I did that until August of 2022, where I actually transitioned and transferred to the emergency department in the same hospital, where I was also a patient care technician, where I currently also work. And very different role, although they have the same title. I work a lot closer with providers as opposed to only nurses. And I'm very lucky I get to do splinting and blood work and wound care. So I'm a lot more hands-on and a larger variety of patient cases that I get to see. And I also, starting last July, was working as a medical assistant, where I also still currently work in a cardiologist's office, who is a private physician who's affiliated with the hospital that I work. And within that office, it's more what you see in an outpatient setting, with rooming patients as my role, and obtaining their vital signs. We do an EKG on every patient. Also, prescription refills and occasional scheduling and more office type work. So I'm still in the emergency room and still in this cardiologist office currently. And I kind of spoke about some of the work that I've been doing, but kind of relating it to medical school applications. When you apply, you have you list up to 15 experiences throughout undergraduate or in any growth years that you've taken. And then out of those 15, you choose 3 that you consider the most meaningful. And so for me, my most meaningful were my roles as a patient care technician, working, in that clinical side. Of course, this program, VT Reach, was definitely most meaningful for me. And then I was a project leader of a media initiative called MScan, which had to do with some educational social media outreach during the beginnings of the COVID-19 pandemic, and working with some current medical students at UVM LCOM and helping them with that. I also, stated, as a medical assistant, I was a server in college. I did some applied research and some other undergraduate research opportunities, as well as, different community engagement. And then just some hobbies and interests of my own, which I think is important to note, as we always ask our panelists about their work and life integration. For me, I really enjoy reading, and then running and walking outdoors. And then I love spending time with friends and family, and traveling if and when I can.
Thank you.
Now we'll move on to Gillian.
Yes. And we will be taking questions after this. And I did want to mention that Lily and I are going to talk about a little bit more in depth what we did for the MCAT and the application timeline. And so if people have questions for us, they can put them in the chat and we'll address them at the end. So for my inspiration into medicine, I feel like it did come a little bit naturally. I think this is a little taboo to say, but I really loved Grey's Anatomy, and that was my first kind of exposure because I didn't really have a family that was in healthcare that was around me. And while Grey's Anatomy does not represent a real healthcare job at all, it was my first time seeing like what a doctor does and how they interact with their patients and how their job is to ease suffering. And I really, really liked that and knew I wanted to learn more. And so in high school, I was able to take advantage of some opportunities. Going into my junior year, I did a SOAR program, which was through my local hospital and allowed me to shadow in my hospital's nursing home. And then after that summer, I actually just stayed with the hospital and volunteered in a couple different departments up until I graduated. And I also did this program called New Visions, which is a New York State BOCES program. And so my senior year of high school, I was accepted into this after applying, and you have to do, it's pretty vigorous to apply. I had to get letters of recommendation and write an essay and do an interview in front of a panel. And I got to take through this program anatomy and physiology, medical terminology, medical law and ethics. I think I got a government and English credit through it as well, but we would look at things like tort law or economics of healthcare. And I would have class Mondays and Fridays, and then Tuesday, Wednesday, Thursday, I got to shadow as a senior in high school, all different fields of medicine in my community. So at 17, I got to see a live vaginal birth, which was incredible. And I got to see multiple C-sections, an open bowel resection. I remember cleaning a freshly cut off finger in the urgent care. We followed dentists, chiropractors, healthcare administration. And so that was really solidifying for me that I have the confidence to be in this field, because not everyone can be in that environment. It's just not for everyone being around blood in the operating room or being alone with patients in rooms, being able to have that casual small talk and conversation. So that was a solidifier that I knew I was in the right field of medicine, or right field of a job in general. I did go into college with an open mind because there are a lot of great healthcare opportunities you can do, as we've shown throughout this program. But I did want to go in pre-med because I knew it's the longest path and that I wanted to start early if I did make that decision later on to pursue becoming a physician. And so I went to the University of Vermont as well, where Lily and I did major in neuroscience and minor in chemistry. And I really liked neuroscience as pre-med because you got the pre-med courses, but like Lily said, you didn't have to do the plant biology side, and the the neuroscience major, you could take it more of a bio route or you could take it more of a psychology route. And I really liked that freedom. I also did the honors college at University of Vermont. So I wrote and defended a thesis in research, which was a really good experience. And so like Lily, I graduated and we studied together for the MCAT, which I took in September of 2021. And after that, I began working as a medical assistant in a primary care office one town over from where I grew up. And I'm really, really happy that I ended up with this experience. There's a lot of incredible jobs you can do post-grad or during college to gain patient experience, but working in primary care, I feel like gave me a really good perspective on like the center of the healthcare system, because we communicated a lot with specialty offices. We followed our patients that were in the hospital. And there's a lot of reoccurring patients I got to see and meet. So I really liked being in primary care. I started out mainly just rooming patients, taking their history and vitals, preparing their charts. And then as I got more experience, I was able to help triage patients with providers. And so every state has different laws about what a medical assistant can do. In some states, you can actually give vaccines. In New York, I couldn't do that. And I can't ever advise a patient, but I could take all of their information in, or if a patient called with certain symptoms, I would pass it on to a nurse if it was out of my scope. But I was able to have a lot of really good conversations with patients, give them results, remind them to do labs. A lot of like, especially, I'll talk about this later, but your customer service is really important in healthcare because you want to be able to communicate with patients that are in frustrated states of mind, they're sick, they don't feel well, and being able to have those conversations, I think, built a lot of skills that are really important for healthcare. And I also worked on my medical school application during this time. And then in January of this year, I got a unique opportunity to come out to Cincinnati, Ohio, and live with a family friend where I am now. And I'm kind of working as her private chef and housekeeper, which is really fun and just something totally different. Before starting medical school, I knew I wanted to take a break from just being go, go, go really since graduating college. And that's where I'm at now. And so for my work and activities, how the medical school application set up, which I didn't fully know up until I started doing it more, is that you only have, I want to say 750 words to describe your activities. And then the ones that you say are most meaningful, you get an extra 1,350 words, I believe.
I'm going to correct you, Jill. It's characters.
Characters. You're right.
Big
Words.
difference. 750 words would have been great.
Good
But
correction.
characters.
It's very short and you have to use this section strategically because you don't want to just say I did this. You want to use this section to demonstrate, I don't know the right words for this, but to demonstrate like your commitment or what you learned, like how it's changed you or impacted you. You don't just want to say that I did that. I took vitals and roomed patients. You want to talk about the impact it made on you. And so for my most meaningful, I selected being a medical assistant for the reasons I described, and mainly for the patient interaction. That one-on-one time I think is so important to get before committing to going to medical school. I talked about VT Reach. This program has been wonderful in the sense of focusing on leadership and organization, but also meeting so many incredible mentors and really understanding what all of these roles in healthcare do, because even though they're not roles that I ended up pursuing, they're going to be my coworkers, they're going to be the people that help me take care of my patients, and being able to understand their educational background and the diversity of their paths, I think is really important. And then I talked about my 8 years in the service industry. I grew up in a tourist town, and so my town got really, really busy in the summers so I've been working first in like an ice cream shop and then in restaurants since I was 14. And I remember one of my first bosses when I was busing said that being a server or working in this industry is like being a swan. So you look very graceful gliding on top of the water, but your feet are paddling very ferociously underneath. And I think this really relates to healthcare because you're doing a really complicated job, takes a lot of brain power, takes a lot of teamwork, communication, things that you use in service. And at the end of the day, you're communicating with a patient in a really vulnerable state. You need to be calm. You need to be able to express yourself clearly. You can't really let the panic and stress of everything that's going on around you affect that time. And so I think that the skills that I built in the service industry are really, really important. I also talked about my time as a sexual assault hotline advocate, which was just a really important volunteer project for me. I talked about, as well as Lily, being a project leader of MScan during the COVID-19 pandemic. The biggest takeaway I had from this experience was learning how to take really tough scientific information and put it in digestible and understandable terms while still holding up the integrity of what a research study means, which is something doctors are doing all the time with their patients. You're doing so much education on really complicated things, but you want that if your patient's not understanding it, then you're not being effective at your job. So I think that was really an important learning experience. Additionally, I got to be a patient safety companion, and I did this all throughout the time I was a medical assistant. My primary care office was part of a larger hospital, and so I was able to work overtime as a patient sitter. And while I wasn't certified as a tech, so like Lily was, I couldn't help a patient get up or go to the bathroom. I would have to call help for that. I would sit with high-risk patients that had dementia, or there's a variety of reasons why a patient might require a safety companion, and I would just make sure that they stay safe. And it was a lot of keeping patients company, having good conversations. We would watch Jeopardy together or whatever movies on the TV, because the hospital is a scary place to be a lot of the times for patients. And so that experience was really great, and that quality time that I got, and also being able to see the hospital side since I was working in outpatient. I also talked about nannying, which I did a lot when I was in Saratoga, as well as physician shadowing and a community engagement recognition that I received along with Lily for VT Reach. And then finally, I talked about my research, which I did in sex differences and neurobiological mechanisms of habit formation. I did research pretty much all throughout college. I was in a microbiome lab for my second semester of my freshman year and first semester of my sophomore year. But then I knew I was going to have to write a thesis. And so I switched gears to something that was just more meaningful to me. I really connected with Professor Tufexis, who I wrote my thesis in her lab and worked in her lab from my sophomore spring semester until I graduated. And the underlying kind of mission of her research is how women have been, or females have been, left out of neuroscience research and really research in general for a long time, just because researchers would look at menstruation as an added variable that they didn't want to look at. And it wasn't really until 2016 that it was actually mandated that all researchers must look at sex as a variable when doing research. And this has been done historically throughout medicine. So a lot of our understanding comes from only men. And so contributing to research that's looking at those sex differences was really meaningful to me. And I really enjoyed that lab environment. And so, and I guess I didn't talk about my outside hobbies, but things that I also like to do is definitely spend time with friends and family, visiting my friends and family that aren't near me. And I really love cooking. And I do a lot of that here in Cincinnati. And so Lily and I will now talk about what we did for the MCAT. And this is just what we did. I don't think either of us would say this is the way you have to do it. I definitely want to add that we are really, really fortunate and thankful to my parents who housed us and fed us during this process. Like, that's a really privileged position to be in, to be able to dedicate the 3 months that we did to studying. So I'm extremely grateful for that. I don't know if you want to chime in, but to kind of start, we focused on content review for the first, I want to say 9 weeks, and we used the Kaplan books to do this. Lily and I, again, lucky, were able to split the cost of a lot of the books because studying for the MCAT is very expensive. So we split the content, or we split the cost of the content. We each bought the AAMC 3 exams, which I think is pretty important to buy, as well as their resources. I
was just going to say, yeah, definitely. Like, I think it's important to note that Gillian and I were kind of in a more unique situation. We are very privileged that we had Gillian's parents who did house us. And we were also privileged in that we dedicated this summer and these 3 months exclusively to studying. We did not manage working jobs of any type, which is, of course, not necessarily accessible for everybody. So definitely of note, this is not the plan for everybody. It's not what's going to work for everybody, but seemed to make the most sense for the two of us and our situation. And again, being that we were very close friends all throughout college, and knowing that we were happy to split a lot of these things. So we were sharing one book when we were doing content review, which again might not be ideal for some people who also others who do better studying alone. We both came to realize in our undergraduate that we like to work collaboratively and talk things out loud and bounce things off of each other. So studying together did just make more sense. And we also like to think that it was going to be somewhat more fun, because it's definitely can be a daunting process and a daunting thing to consider.
I would say studying for the MCAT too is emotionally tough because you feel like it's the most important thing in the world. And there's a lot of ways you can do this, as we're both saying. Knowing Lily and my situation to kind of prepare, we watched a lot. I watched a lot of YouTube videos of people just talking about their experience, looked up resources for study plans. And then if you are in a position, people do, like, there are classes and courses that you pay for that will make this setup for you. And some people really need that and are fortunate enough to be able to do that. Definitely not necessary, but I know it can be helpful. And I do want to add that in one of my interviews, I was asked in depthly about like exactly what resources I used, how I studied, because schools do consider if you're studying for this exam and working a full-time job, your score is going to probably be a little different than someone who took a course for 6 months or took a 3-month course. And it's just considered. The score is one part of your application. It's an important part and you want to do your best, but it is just one part. And so I know when Lily and I finished this exam, we both decided on our own to not retake it because we felt that our efforts were going to be better served focusing on other parts of our application. For me, that was going to be working experience. I knew that was more important than trying to take this test again. Everyone has very different opinions on what a score means to them. And I feel like really your score is just kind of solidifying what list of schools you're going to be applying to, because you want to apply to schools that are plus or minus a few points of that. But at the end of the day, it's not the thing that's going to keep you or make you a doctor. There's a lot of other things that contribute to that.
Yeah, but yeah, in terms of studying, like as Gillian was mentioned, we started focusing primarily on content review. Refreshing ourselves with some concepts that we hadn't learned since freshman and sophomore year of college. So it had been, 2-3 years at that point. And then we also would take a full length practice exam, and we would try and kind of match test day environment to the best of our ability. Going to an alternate location and taking the breaks as recommended, and
starting at the time we would start the test, kind of
yeah,
the same type of lunch we would have brought.
yeah, we were eating the way on these practice exams that we were hoping to eat on the test day. Again, like not having your phone on you, they take your phone and it's like locked up, things like that, just to really build up that kind of stamina. It's a long exam. Yeah. It's about 7 hours. So we were doing that as well. And then in between a full exam day, we would then spend the next day to 2 days really in-depthly reviewing that exam. So we would go through each of the 4 sections. For those who are unfamiliar, the MCAT is split up into 4 sections. Each are about 90 minutes, and they're passage based. The first one is chemistry and physics. The second section is called CARS, C-A-R-S. It's kind of like a critical reading and analysis portion that's actually has nothing to do with any science type classes. The third section is biology and biochem. And then the fourth section is psychology and sociology. So those are kind of like those main overarching topics that the MCAT covers. Some are more in-depth or high yield, as you'll see is kind of used a lot during in MCAT practice books. And you learn throughout studying what topics you really need to know very well, and other ones that you are unlikely to come across, because it helps you kind of designate your time and effort, because it's just impossible to learn everything. It truly is. You're not going to learn everything as in-depthly as you might like to, but that's still okay. Again, you're unlikely to get a question about every single little topic.
I would say this exam was really different than anything I'd ever taken before in college ever, because any other test you take is a biology exam on a unit that you study for and you know about, but this test takes a biochem, an orgo question, and a physics question and combines it all. And they're putting all of these terms into these readings that you then answer questions based off, and they don't expect you to know the random bacteria they're referencing. They want you to pick up on the context clues and like use scientific reasoning and combine a lot of your knowledge. And it's challenging, and it's really takes practice. I think Lily and I have talked about what we would do differently if we took the MCAT again. We used Anki to study for this, which a lot of medical students use to memorize information. It uses spaced repetition. So it's like a flashcard, and then they'll give you a flashcard and you'll say, I either confidently know this, I sort of know this, I don't really know this well, or I don't know this at all. And then it'll show it to you again in a time based on that. So if it's a card you're confident in, you might not see it again for a week. And then if you're confident in that again, you might not see it for 2 weeks, versus cards you're less confident in, you'll see often. I think in retrospect, I would have spent less time on content that I was strong on and more time taking more practice exams, because I think that's really the best way to learn this like scientific reasoning that this test is so different and asking you questions based on. And so that is the one thing I would do differently. But overall, it was very challenging, and I was happy to successfully make it through.
Yeah. And again, we also did this in a shorter time. Many people do this over the course of 6 months or 8 months or 9 months or a year. So we kind of knew we were taking on a more accelerated or condensed version of this. But again, like we talked through what was going to make the most sense and what kind of fit with our goals and things like that. And this is how we wanted to do it. So if that doesn't seem doable, of course, like you don't have to do it in 3 months either.
My other advice would be to myself is to do the Jack Western CARS passage of the day, like starting your junior year of college or starting a long time before you are even thinking about this test, because the CARS section specifically is just a skill and it has nothing to do with science. It's more about reading and like
study for it.
Reading for the author's point of view, and it's just very unique. And so the more practice you have with that, the better. And it would take like 10 minutes out of your day, do it 3 times a week. That would be my recommendation to my younger self. I think that would have been really helpful. And this was just kind of showing how we tracked our exams. I think it looks like we took 8 in total. And I know they say that your average, how you do on the last 3 AAMC practice exams, which are the most accurate, is pretty much the average of how you'll do on the exam. I found that to be true. But again, you're going to hear a lot, like if you're going through this process, you're going to be hearing a lot of information from a lot of people. And I just think the MCAT's very individualized. You want to do your best on it, but it's one part of your application. And there's a lot of other important parts too. Unless you have anything else to add, Lil.
No, I don't think so.
And then just a little bit more information before we do take questions on the timeline, because it really like takes a basically full year to submit your application, really longer because Lily and I will both be starting school this July. And we started this application and pretty much after our MCAT exam. And so November through January, we worked on the health professions portfolio through the University of Vermont. And I know a lot of different schools have different ways of helping their pre-med students. This is just what Vermont did. And I found it extremely helpful. You do a personal statement rough draft, but you also answer a lot of reflective questions. And it just gets you in that mindset of, why do you want to do this? These questions made it so even when I was with a patient sitting or working as a medical assistant, I was thinking more about what interactions were meaningful and why I wanted to be a physician. Because these questions like this, you have to really, really know that you want to do this. And it's not something I feel like a lot of people want to be a doctor because they want to be a doctor. It's a well-known thing to do, but you have to really look inside you and reflect on why you wanted to do this in the first place, the life that you want for yourself. It's a really big commitment that you're making. And so I found that the reflective prompts of this and just having that time to be really helpful later on, especially when you're writing all of your secondary applications, because that's a lot of questions coming at you at a fast pace. You also have to do a lot of just organizing of your transcript, and you have to code all of your classes properly. And there's a lot of little places you can make a mistake, and you really do not want to give a medical school any reason to write your application off. And the letters of recommendation. So thinking meaningfully about who is going to advocate for you and write you a really good letter. Some schools, which I didn't know, I had only one school that required a non-science professor write a letter. So like really looking in the details of what different schools and programs you want. And so then, do you want to
just gonna say, I feel like it's pretty common. Almost every school I applied to, they also have varying amounts of letter of recommendations that are either required or like a maximum limit. So I feel like it's kind of good advice to have at least 5 people who you know you can ask and will write you a strong letter. One being almost every school was required a lot of recommendation from a science professor, a STEM course professor. So that's just important to be thinking about. I did have a handful of schools ask for someone non-science. And then it also is really beneficial to have a letter of recommendation from a physician themselves. Medical schools really value that. Again, that you've kind of shown that you've put yourself into situations where you've seen healthcare and not just thought about going into healthcare, you've actually experienced it, whether that's through shadowing or other clinical experience. And then a lot of times, like, if you had a job that you've worked at a really long time, or another type of activity where you had like a supervisor or someone in that type of role, I feel like that's also someone good to have in your back pocket. And then some schools allow you to submit, all 5 or 6 people, while others only let you submit 2 or 3, but kind of a good rule of thumb to have too many than too few when it comes to writers for you. And to
definitely.
make sure that they're quality and not just.
And asking you, like I had one professor that set up a Zoom meeting and we talked and asked, will you write me a strong letter? And they'll be honest, and they have a lot of students asking them. So being ahead of the game in that sense, and just being really prompt and appreciative is important. And then for us, we were really lucky. In January, we meet with Kara Calvelli, the pre-health advisor at Vermont, and she kind of runs through your portfolio with you, talks about schools you'll apply to, gives you a really honest advice about how she thinks you'll do in the cycle. And so much of this is unpredictable. I know Lily and I both applied this cycle knowing that we might not get into any schools, and doesn't mean we're not going to be physicians. It's just a really hard thing to do. And we're both very, very lucky and fortunate and excited to have acceptances. And so after that meeting, you spend a lot of time rewriting your essay. I had a lot of friends read my essays. The personal statement, I think I probably wrote 10 versions of it. And my final personal statement was probably like a little piece of each one of those, as well as spending a lot of time writing about your activities. Like I was saying earlier, like this is another chance for you to talk about yourself, even though you're talking about what you did. And so putting a lot of time and energy into those is really important as well. Then in May, the AMCAS and ACOMAS systems open up. And so you can put all of that information into the application servers. And then at the end of May or very beginning of June, you can actually submit and apply. And you want to have everything done early. That's the advice we always got. Med schools are rolling admissions. So while you could submit your application anytime between June and September, you're just going to have a better chance of being seen and reviewed and get interviewed by submitting earlier. And then at the end of June and July, all of the secondary essays begin rolling in. And I believe the rule of thumb is you want to get these back in about 2 weeks. And that was a lot of writing, a lot of essay writing, which is where the health professions portfolio really comes in to help, because a lot of these prompts you've thought of in some way, shape, or form. And then a lot of it is why our school? And so taking the time to learn about the programs you're applying to, and also apply smart about the programs you're applying to, because every single one costs a lot of money. Every single secondary costs additional money, and it builds up. And so you want to, it's a very tough thing. I've heard of people applying to just a couple programs. I've heard of people applying to 20, 30 programs. I think I ended up applying to like 17 or 18 in total. And that number is really different for everybody. And then after that, it's kind of silence and just a painful waiting game of waiting to get interviews and admissions decisions. And that is really.
I was just gonna say to make a note on like primaries and secondaries, something that like I didn't really know that much about. Your primary application is probably very similar to like your undergrad school application when you're applying to colleges, things like that. Again, it's on this like one main portal, and you input all this information, you click submit, and it sends it out to these schools. So and basically all that they're really getting from you is your transcript, your personal statement, and then these work/experiences. Which again, like 750 characters is not a lot. I'll tell you that it was very difficult to fit everything that you wanted to say in that few words. But that's basically all that they receive. And then again, you'll get this invitation to complete secondaries, which are for each individual school. And that kind of ranges anywhere from like 1 to 8, I would say, sometimes more. Additional like essay questions, usually all with word or character limits. Oftentimes, why this school? I think almost every single school Gillian and I applied to also had a question regarding the COVID-19 pandemic. If you wanted to state if it affected your studies or application or experiences in any way, shape, or form, which was definitely newer since the pandemic, wasn't always around. And then often questions and times, describe a time that you failed that in a non-academic setting, or give an example of a time where you had to overcome a conflict, just kind of things of that nature. And
wild card questions that you wouldn't expect.
Yeah, some are also just very odd that you're like, what does this have to do with anything? But there's always a method to the madness. What was also super helpful is sometimes, again, even though, we applied pretty much as early as we could, there's almost like a rolling admissions, and sometimes you'll hear back from a school with an invitation for secondaries very quickly. And other times, like I was still receiving some in August.
Yeah.
However, you can access a school's secondary questions that they're sending out to their students in advance. You can Google them.
Last year.
Yeah, or most of the time they're very similar from the ones from last year. And that allows you, like Gillian and I had a lot of our secondaries completely pre-written before we had even heard from a school to submit them. Which again, just allows you to kind of be ahead of it. And when you get that invitation, to use the opportunity to proofread them, tweak anything that you want to say, and then send it back in like a pretty timely manner, because it really does make a difference when it comes to rolling admissions. And then, you are faced with some silence, a lot of waiting, and then some, you'll get some interview invitations. So we also forgot to speak about the Casper.
Oh yeah, we did both take the Casper exam.
Which is not required. There's like some schools that require it, but not all. But it's just another test that you should take.
They don't study for it. It's a situational judgment exam. And it's really not something I would tell anyone to stress about, but it is. I would reiterate again and again how important it is to time manage and be organized throughout this process. Because there's a lot of boxes to check, whether it's the Casper exam. As Lily was saying, every school sent you their secondary on their own individual portals, which are all very different. And I think managing that keeping it organized.
Logins for every single one.
Have logins,
And
passwords. I used Google Docs. I had like a Google Sheets that had everything. And then I attached in a document for each one where I had secondary, my login info, when I submitted. I just think the more organized you are, the better off you're going to be, especially in that month of July and August when you have all of these secondaries coming at you and you're trying to prioritize. And Lily and I are working full time at this point. And so it's a lot, and making sure that you're prepared for it is the best advice I would have to give on that sense. And then really we added some photos of us throughout the years. This was freshman year, my sophomore year dorm, us in a science class, graduating. I really couldn't thank Lily enough for being a part of this process with me. Just having a person go through this with you has made it infinitely better, and I am forever thankful for her. And then we are here to answer any questions you have. And so please put them in the chat if you have any. But to start, I do have a question for you, Lily. I want to know what you would say is the most challenging part of your growth years, and the most rewarding. So challenging and most rewarding.
I think there's definitely a lot of rewarding and challenging aspects about this. I think in a sense, and at least for me, kind of a harder part of this was obviously you meet a lot of people in undergrad, you become friends with a lot of people, and those who aren't pursuing healthcare kind of graduate college and often, in a sense, start a real person job or start, move out of their parents' homes or, from college and move into their own apartment and are kind of living a lot more independently. And for me, I moved back to, I live in my hometown and I'm still living with my parents, kind of thinking about the financial burdens that medical school is going to place on me and trying to be a little bit financially more responsible and save money while where and when I could. So it can be sometimes hard to see your peers or your friends have some more independence or starting their adult lives a little bit ahead of you. And it can feel a little bit isolating at times. So I think that can be a little bit challenging. I think that I wasn't fully aware of the financial burden that applying to medical school also would be. That the applications are very expensive. Materials for MCAT were very expensive. So again, like being financially responsible and staying at home has definitely helped. And I guess for rewarding, I'm very thankful for the clinical jobs that I've worked on an inpatient floor and in the emergency department and in an outpatient setting. I just feel like it's given me such a great opportunity to see these different realms of healthcare, to see how healthcare teams work together, and to really truly have these interactions with patients. And to be able to do a program like this just gives me constant reminders of why I want to do this and can make all the less glamorous parts of the application and starting school very much worth it. And so those are those are good reminders to have in a sense. That's what I guess I would say about that. I was going to ask you, Gillian, what do you think throughout maybe your undergrad or your work or experiences had the biggest impact on your application, or you felt made you a good applicant?
That is a good one. I'd say, I think not focusing on too many things, because I definitely went into the mindset. I came into college really, really eager about being pre-med. coming off of the New Visions program, and I felt immediately like I had to do the most. I felt like I had to be doing research and be joining all these clubs and like trying to have my feet in everything. And I remember meeting with Kara, and it was my first summer after freshman year, and I wanted to work back in the restaurant because it's really good money. And I was feeling stressed that I should have been doing something healthcare related. And she said to me, she was, right now, you just need to focus on getting good grades and focus on, like, if we talked about how working in a restaurant has a lot of benefits to being in healthcare. And I ended up talking about that on my application. And the same thing with working on MScan, we put a lot of energy into that. Like Lily and I were able to build a big social media page from it. And that's really what kind of gave us the confidence and public speaking experience to then do this program. So I'd say showing leadership in things that I was really passionate about and I think waiting to find that project and pursue that project instead of feeling like I had to have my hands and feet in all of these different clubs and organizations. I think that helps on your application. My next question for you, let's see. At any point, did you want to change your mind and pursue something else? And what was that process like? What made you always come back to healthcare and becoming a physician?
Oh, that is a good question. I think like when I was a kid, I think everyone goes through so many different phases of like what they want to be when they're older. But when I kind of had that point where, and I feel like many people kind of agree with this, who end up pursuing medical school and becoming a physician in particular in that world of healthcare, is you reach a point and you just can't imagine doing anything else. And, I've never, in a sense, although like I have felt like that, I couldn't picture myself doing any other type of job. I also wouldn't say that I've ever been closed-minded or felt like I won't even think about anything else. I just feel like the times that I have thought about another job or another role within healthcare, it just didn't seem fitting. And something that, a lot of interviewers will ask is kind of why medical school? Again, like there's so many other avenues into healthcare, which we try and highlight in terms of like nursing or PAs or things like that. And I think just for always like kind of reflecting on that type of thought can also really help you in your application deciding if is this truly what I want to do? Because as I think we've kind of demonstrated, it's a very long process. It's daunting. It can feel very difficult at times. And it has a large financial burden. It has a large time commitment. And if you're just interested in healthcare alone, there are many other careers or paths that you can kind of end up in. But for me, just none of those seemed fitting with kind of what I wanted to do with my life, the impact that I kind of wanted to have, and the type of learning and long-term career goals that I have. So in a sense, I was never closed-minded to other careers, but they just never felt right. And I just kind of kept coming back to my curiosity and love of learning and love of science and anatomy and physiology, and those desires to continue to learn and to be in a field that's ever changing. Again, you're never out of information to learn, and that's just like really sounds so inviting and enticing to me, would be my answer to that.
Well, I think that's a great answer. I do think Lily and I actually talk a lot about this, and that's why I do think it's important to have people going through this with you, even though we work really different jobs. There's a lot of really discouraging things you see in healthcare, a lot of problems within healthcare. The answers are not clear cut. I think we all go into this field with this mindset of we're helping people and it's going to be great and like wonderful. And there's a lot of really hard things about being in healthcare. And we talk about that with our panelists here about taking care of your own mental health. Don't really know where I'm going with this, but I do think it's a realization and just something that is difficult about healthcare that you don't always know, and why that patient experience is so important, and questioning why you want to do this. What difference do you want to make? What kind of provider do you want to be is really important for not your application, but yourself and your life, and being fulfilled and feeling like you have done what you were meant to do, if that makes sense.
Yeah, again, kind of like as what I mentioned too, it's just super important to think about for yourself, because I was asked in almost every interview that I had, again, like, why do you want to be a doctor of all things and not something else? So it's good practice to be reflecting. And Jill also touched upon this, like within the health professions portfolio, we answered a lot of questions that didn't have much to do with our application in general, or necessarily were things that we ever saw on an application, but was just really good practice in these reflective question or ways of thinking, that I've also really enjoyed. On the flip side, kind of, I really enjoyed that aspect of the application, and I enjoyed being able to think about these things and think deeply about why I want to do this and the type of provider that I want to be. And that was like a really great opportunity to have during the applications. So I don't want people to think that, it was all, you know,
Mhm.
bad or a
It's a
lot of
lot.
work and a lot of
It is a lot of
time.
work, but important work.
It's for
And
a reason. It where I am now, like looking and now currently reflecting back on the application process, everything made sense. They have a reason for everything. And, for the most part, I understand why it had to be that way, or why those questions were asked and things like that. So I think that that's also important, that it does feel worth it. And yeah, I guess that's,
And I would say, I think we touched upon this a little bit as well, but it is hard. It is such a waiting game, and it's really, really hard. And you just feel like your future is in the hands of these outside sources that don't know you as a person. All they're knowing is what you've written down on these pieces of paper. And it's hard. It's a hard waiting game. And so having support from your friends and your family is really important. Being able to communicate that and take care of your mental health, and know that you are going to end up where you need to be. And so like, Lily and I are very, very fortunate that we were able to get in only applying on one cycle. So many people have to apply to medical school 2-3 times. And if it's what they're meant to do and they feel that driven, they make sure it happens, and they end up where they're meant to be.
yeah, we used to, in the throes of it, we used to, remind each other that if we want to go to medical school, we will go to medical school. It might not be this year or next year, but if it's something that you really want to do, it will happen. You can do anything with the right motivation and the right goals and things like that. So it was a good reminder that sometimes, if it didn't work out this time, although it does seem discouraging, there is always another cycle, and you'll learn a lot from the process. And
You just become a better candidate.
yeah, you just continue doing the things that you're supposed to be doing and that drive you, and then it ends up paying off. So, yeah, I think also something that has still stuck with me, um, from our very first VT Reach panel, when we were hearing from current medical students and their own journeys to and through medical school. One of the panelists said, he took quite a few years off in between undergraduate and going to medical school. And he was like, I have the rest of my life to be a doctor. Um, but I only have this time now. And I think that's also important to touch upon, that there's no correct timeline for anybody. And medical school will always be there, and being a doctor will always be there. So it is also a great opportunity to do things that you enjoy, or you didn't get a chance to do while you were in undergraduate. And and to, work or travel if you can, explore hobbies.
Take classes that you want to take. Looking
Yeah.
back on, I mean, I have no regrets majoring in neuroscience. I really feel like it was a great fit and I valued every bit of that experience. But I think people go in saying, oh, I want to go to medical school. I've got a major in biology or a STEM field in some sort. And I just think the more unique you are and the more you do what you're called to do, the better candidate you then look. Like as long as you take the chem classes and orgo and science things that you're required to do, you could major in anthropology or English or like really anything. And I just think it makes you a more unique candidate. And if you're really passionate about literature, you should do that in your undergrad experience because you're going to have 4 years of medical school. You're going to learn everything you need to learn as a doctor then. And so if you have a calling for anything else during undergrad, I really suggest pursuing it. Some of my favorite classes were my non-science classes. So I would recommend that to anyone unsure.
Yeah.
Mhm.
And of course, I mean, this is just what we did too. This is just all our advice and our tips or
We're
how
just
we did
girls.
things.
We're pretty similar. So
But yeah, like I was saying, there's no right way, there's no timeline, there's no anything. There's not really many rules to the application process, which is encouraging, I feel like in a sense.
yeah,
Um,
utilizing all your resources that you can and reminding yourself that it's your journey. I think that kind of what you touched upon, Lily, about post graduation, your whole life, you go through doing everything at the same speed as everyone else. You graduate high school, you go to college, if that's your path, and when you're in college, everyone's doing the same thing, even if you're different majors, you're still all having a very similar experience. And then after college, it just all changes and everyone really is at a different place. Nobody really actually knows what they're doing. And it's a very individualized experience. And I just think that's kind of a thing every person goes through in life, no matter what. And especially in terms of committing your life and to being a physician, the amount of debt that you're going to go into to really utilize that time. I know I went into college thinking I wouldn't have wanted to take a growth year, or like maybe I used to think, oh, I'll take one gap year and I'm going to backpack through Europe. Like that's definitely what I said I was going to do. Where I'm very glad I took two, and I'm very glad I worked and got experience and became sure that this is what I want to do. And Lily and I did go to Europe for a week, so kind of got to live that dream out.
yeah, we've been able to have a lot of great fun experiences outside of work and outside of applications in these past couple of years, which I've been thankful for. And it allowed me to also just it allowed, I think both of us, I think we talked about just before, to have also more balance as undergraduate students. There can be quite for lack of a better word, like the toxic pre-med stereotype, a lot of competition and not really being helpful to each other, that you always have to be studying or doing something or pursuing extracurriculars. And you can kind of forget that you're also, in a really important time in your life when you should be making like great connections with people and trying and experiencing new things. And I feel like Gillian and I were very thankful that we felt like we were able to have a good balance in terms of maintaining our grades and working on those extracurriculars, as well as, spending time with our friends and doing fun things and exploring parts of Burlington, Vermont and the state of Vermont and things of that nature. So I think that's also important to realize as well.
Yeah, I'd say just to add on top of that, I definitely agree. And I'm glad that you mentioned that, Lily, because I do think the pre-med community can be very intense and very like, oh, you're not doing this, but have you heard of this? Have you not done that yet? And it's just a lot. And as we've said, I think the more unique to yourself that you are, the better candidate you are, because every single person is going to have the experience, or like everyone does a lot of the same things. So just really following your own path, doing things that you're interested in for yourself is going to take you a lot further. And really just, as like Lily said, enjoy your time in college, because you're going to learn everything you need to learn in medical school. As long as you keep your grades up, have fun. And I feel like we can wrap it up there.
Yeah, that's a good
Yeah.
ending.
I
And
do.
again, just yeah,
You go.
go ahead. No, go ahead.
I was just going to say, I do want to thank Dr. Merriquin again for being so encouraging when we brought this idea to her. She definitely is the magic behind a lot of this. She says that she takes the back seat, but she brings in really, really good speakers, people that are great communicators and were wonderful panelists to get to know. And then we really want to thank Kara Calvelli, who made it such a difference in both of our applications and just supporting us, being honest with us, uplifting us. And she's also spread the word of this program, has gotten it to over 550 students have been able to sign up for these. She shares the YouTube videos. We really could not thank both of these inspiring women enough. And it's bittersweet that this is the last one.
Yeah, and thank you to everyone who's been joining us for the past 2 years. If you are a current UVM student and you are interested in anything pre-health, please reach out to Kara. She is such an incredible resource, really made such a difference in just like helping you know where you stand and what you can be doing to help your studies. Again, yes, thank you to Dr. Merriquin as well. Couldn't have done it without them. I couldn't have done this without you, Gillian. I'm very thankful to have had you by my side. And yeah, thank you all for joining us tonight on our farewell session.
And if anyone has questions for us, I put both of our contact informations here. I know for me personally, I love talking to younger students. It's always been like, I've always found so much advice from people that were just one step ahead, like one level up from where I was at the time. And so if anyone has questions about the application process or the undergrad experience, please, you can connect with either of us.
Yeah, as you can tell, this is something we like to talk about and can go on and on about. So don't ever hesitate. I always found it helpful to reach out to, people who have been through it or were going through it, all of that. It's always great to hear different perspectives and advice. So thank you again, everyone, and enjoy the rest of your night.